Selamat siang. Welcome back to another latest news from Bali and Indonesia. And this is May 30th, 2022. My name is Bruce. And what's the weather like today? It is beautiful. We had some storms and a lot of rain over the weekend, but right now it is windy, 14.3 kilometers per hour. It is hot, 30.9 degrees Celsius, but it feels a lot hotter than that, and the humidity is 68%. It is a clear day here in Singaraja on the ocean. I love it. Wow, I was out for a walk today, though. It got pretty hot in downtown Singaraja. And it's been a while since a news report. There was nothing really of interest on Friday, and I'm a news junkie. If there's nothing really of interest, there's nothing of interest. So I did a Singaraja snippets, a walk around, and thank you for comments on that, those of you that watch that. Two segments today of this news touch on stuff that I was talking about when I was doing my walking around videos. So wow, what a coincidence. The first three segments today are about health. I was hoping to stay away from health stuff, but health is just pushing forward. Let's start out looking at the numbers. Numbers are good, and well, you would expect that on a Monday, right? After the weekend, numbers are always low, and so what are they? National new cases, 242. National recoveries, 261, and national deaths, 1. So wow, really low. Bali new cases, 9. Bali recoveries, 7, and Bali deaths, 0. So these numbers are incredible. And let's take this with a grain of salt or two, because as I said, it's the weekend, but good news nonetheless. And I was out walking today, and a lot of people still wearing masks. And there were police out checking on temperatures of people. I don't know what is going on there. A policeman saw me walk by. I didn't have a mask on. I was with my son and my granddaughter, and he motioned to a cop in front of us, and I thought we were going to get stopped because I wasn't wearing a mask, and I was ready to say, Pak Jokowi said on the 17th, you don't need to wear a mask anymore. But the policeman did not stop us, and so I don't know what that was all about. And I checked in at the market today, and some people wearing masks and some people not wearing a mask. And of course, no social distancing. And so that's the way things are on health in Singaraja. What is the main story today? The main story is 12 new countries added to the VOA, Visa on Arrival list. What are those 12 countries? Bahrain, Belarus, Bosnia, Herzegovina, Kuwait, Egypt, Morocco, Oman, Peru, Russia, Serbia, Ukraine, and Jordan. And so we are now up to 72 countries. I'm not going to list all of those, but you can take a look at the graphic right here, and you'll see all 72 countries that are now allowed to get the Visa on Arrival. And remember, Visa on Arrival is good for 30 days. It can be renewed one time for another 30 days. You have to do that at the immigration office nearest to where you are. You can do it by yourself. The cost is 500,000 rupees, or you can get an agent to do it for you. And the agent costs, well, somewhere around 800,000. I think that's the number I've been seeing on social media. Why would you use an agent? Well, because if you use an agent, you only have to go to immigration one time. If you don't use an agent, you go yourself, you got to do it 3 times. So the question is it worth paying the extra money for an agent so that you don't have to go and waste part of your day at immigration? Personally, for me, if I was here for 60 days, I would go with the agent, I think, at this point, just to save myself the hassle of going to immigration. So good news for those 12 countries. And what about the B211A? No changes there. And the 6-month visa that people have been waiting to hear about, nothing about that. And the second home, nothing about that. And so the government is taking its time coming out with information on that. So at this point, you have two options. If you are not a resident here, one is the visa on arrival, the other is the B211A. And the B211A can be extended for 6 months, right? The visa on arrival only gets 60 days, 30 and 30 extension. If you get a B211A, you will need to have a sponsor. You are not allowed to, and it has to be an agent. You are not allowed to have individual sponsors yet. What does that mean? Well, it means in the old days you could just get like a friend of yours, or the guy who owns your homestay, or a guy who cleans your pool, and they could have been your sponsor. Now you need to have an agent, somebody that is certified. That is the situation right now with getting in here. Any questions? Leave a comment below. Any experiences that you've had, good or bad, coming in on the VOA or the B211A and you want to share, please leave a comment below. Always interested to hear about that. Okay, and let's get on. I said there's going to be some health segments, and there are. First one, 15 GP 2022 participants contract COVID-19. Right. It is common now for a lot of people here, including me, to get in the mindset of, well, this thing with COVID is over. The numbers are low. We're not hearing about deaths anymore. And most of us are either fully vaxxed or we've had COVID or both. But still happens. And so a number of participants at the Global Platform on Disaster Risk Reduction 2022, that's called GP 2022, in Bali, tested positive for COVID-19 and have been isolated in their hotel rooms and barred from attending the conference in person. Pak Wiku emphasized that all other participants that had physically attended the conference were COVID-free. All participants and organizers of the conference had to take mandatory PCR test and antigen test, and only those who returned negative test results were allowed to enter the venue. As the PCR and antigen tests are valid for a maximum of 3 days, many participants had to take the test a couple of times over the duration of the conference, which ran from Monday through Saturday. Pak Wiku said it was unknown where the COVID-19 positive participants caught the virus, saying that it could have been anywhere. He also made assurances that the affected participants had not entered the conference venue or had contact with other participants after their positive results were announced. A special team was set to work tracing the people who had been in close contact with infected participants. So these folks were not positive when they got here, and they got positive during the conference. And so it's still here. You can still get infected. And so follow the health and safety protocols, mask wearing. You want to wear a mask outside, wear one. You don't want to wear one like me, don't. At this point now, once I go into a store and I put my mask on, I feel like I'm suffocating. I don't know. But the good news here is that the COVID-19 indicators have not shown a significant spike in cases despite the high public mobility following the Eid al-Fitr holiday earlier this month. And so we've been waiting for some spike to happen, and it has not happened. And so that is great news. Enough of COVID-19. Let's get on to another illness. DB cases in Klungkung increase. What are DB? Demam berdarah, or dengue fever. Rainfall in recent weeks has caused the dengue mosquito to start breeding in Klungkung, according to this article. During this month of May, 48 residents were treated at the Klungkung Hospital for dengue fever. Public relations of Klungkung Hospital, I Gusti Putu Widiasa, said that based on surveillance data application used by the Klungkung Hospital, the development of DB cases in Klungkung has increased significantly. And just personally, we've got more mosquitoes here now than ever. With this rain that has come in for the last, what we have, 3 or 4 days of rain and some major massive storms right here in Kampung Bugis. And we got mosquitoes all over. Handling efforts are carried out to get rid of the mosquitoes, including eradicating mosquito nests, and fogging is carried out in DP epidemic areas, especially if cases have been reported there recently. If the larva rate is low, we will do fogging. If the larva number is high, we will promote PSN and abatement. PSN is eradicating the mosquito nets. Abatement methods include use of chemical larvicides in the form of sprays or targeted fogging to eliminate the mosquitoes and their larvae. This combination approach has been used in Klungkung, and pest control officers are still working around the clock to curb the outbreak. Preventive measures are being taken across communities in the area, including the clearing of stagnant water in temple moats, ponds, ditches, and community cleaning operations. Meanwhile, preventive measures are aggressively being undertaken in the community, and people are invited to keep their environment clean so that there is no place for mosquitoes to cause dengue to breed. The regent of Klungkung appealed to all Klungkung people to maintain good health and implement a clean and healthy lifestyle in their respective homes and places of residence. He said, "Don't let dengue fever cause us to feel afraid, like during the COVID-19 pandemic. Let's apply the PHBS concept and start reactivating the use of abatement drugs." Problems in Klungkung with DB, and I haven't heard about other areas specifically, but my guess is that we're going to see this all around the island. When I changed the name of the videos I'm doing from the old Bali COVID-19 updates, I forget who it was who said, maybe you shouldn't do this so quick. What about monkeypox? And well, I've been trying to avoid talking about monkeypox, but here's an article in the Jakarta Post today, I think it's Jakarta Post, on monkeypox. Indonesia on alert as monkeypox emerges in Australia. The health ministry is stepping up surveillance for monkeypox as more cases of the viral disease are being reported in non-endemic countries across the globe, including neighboring Australia. Even though we haven't had a single case as yet, ministry spokesperson Mohammed Syahir urged the public and all health workers to be alert and aware of the symptoms of the disease. What are the symptoms of the disease? Fever, intense headache, muscle aches, back pain, low energy, swollen lymph nodes, and a rash or lesions. These symptoms usually occur between 6 and 16 days after infection, although some cases they've occurred after 5 to 21 days. Countries where monkeypox have been seen that are not endemic countries include Argentina, Canada, Denmark, France, the UAE, the UK, and the United States, and apparently Australia as well. It's unclear what's driving the outbreak, with scientists trying to understand the origins of the cases and whether anything in the virus has changed. The WHO said that there's no evidence of mutation so far. Virologist I Gusti Nur Mahardika from Udayana University in Denpasar said he suspected the recent outbreak was connected to a monkeypox outbreak in West Africa region earlier this year, but he emphasized that more data was necessary in order to support his theory. According to Paxiaril, monkeypox was primarily transmitted to people from wild animals, although human-to-human transmission is also possible. He said monkeypox is transmitted from one person to another through close contact with an infected person or animal, or with material contaminated with the virus. He added that fluids from monkeypox blisters were particularly infectious in the contact with clothing, bedding, towels, and other objects contaminated with the fluid could also infect others. Practicing good hygiene is a very effective way to stop the disease's spread, he said. He also called on the public not to panic. I don't know anybody that's panicking, even if there is a local outbreak, as the disease is usually self-limiting and symptoms generally subside without treatment. The case fatality rate for monkeypox is between 3 and 6%, and no related deaths have been reported so far in non-endemic countries. Okay, enough on health issues. Let's talk about some other stuff. What about plastic? Action plan to strengthen single-use plastic ban. Provincial government of Bali, through the Department of Forestry and Environment, DKLH, has prepared an action plan to strengthen the ban on single-use plastic related to the governor of Bali, Province Regulation number 97 of 2018 concerning restrictions on the generation of plastic waste disposable. The preparation was supported by the Zero Waste Indonesia Alliance, AZWI, the Bali Environmental Education Center, PPLH, the Indonesian Center for Environmental Law, ICEL, and the Indonesian Diet Pockets Movement, Plastic, GIDKP, according to Tisra Mafira, executive director of the Indonesian Plastic Bag Diet Movement, in a release on Sunday, yesterday. The contents of the action plan include the formation of a cross-sectoral supervision team, technical instructions on the imposition of sanctions, ease of channeling public complaints regarding violations, and awarding business actors with good practices. Imade Dwi Arbani, head of waste management, B3 Waste, and PPKLH of the Bali Provincial Forestry and Environmental Service, said the workshop was a preparation to respond to the current waste emergency situation in Bali province. Waste emergency situation. Ooh. One of the conditions, he said, is the planned closure of the Suwon landfill before the G20 summit in November. Okay, and so, well, you could expect that. They don't want that landfill to be an eyesore when you get all of the G20 big shots showing up here. Currently, the use of single-use plastic is increasing again, along with the full opening of economic activities in Bali. Limited research on the plastic-free market at Sindusanu Market by PPLH Bali and GIDKP shows that the use of plastic bags, both large and small, has increased by 70%. And I can verify for here, plastic bags are still being used in some shops. Now you go to like supermarkets, Clandy's here, or any of the mini markets, they do not use plastic bags there. But if you go to the traditional market, plastic bags are still being used there. And I went to a couple of stores today to buy a toy for my granddaughter and some tiles for the house. And what did they have? Plastic bags. Okay, so plastic bags are still being offered. And one final segment on the road situation here. If you watched any of my last two videos, I was talking about the road, and people made some comments about the road upkeep. And I said that a lot of this is washed out because of the ocean. This article is exactly on this. Handling abrasion in Buleleng needs 14 billion rupiahs. 1 kilometer of the coast of Buleleng is reported to have experienced abrasion. Okay, this is washing away. Abrasions is washing away. However, the abrasion control cannot be implemented this year. According to the head of Public Works and Spatial Planning in Buleleng, we proposed to control the abrasion this year, but it seems that this year it has not been executed. The proposal to install 1 kilometer of armor stone requires a budget of around 14 billion rupiahs, according to Putra on Friday. 14 billion rupiahs. Okay, so they want to shore up. I'm not sure what armor stone is. Maybe it's this stuff we've got here along the seawall in front of my house. Buleleng, with the longest coastline in Bali, which is 157 kilometers, has a very high chance of being affected by abrasion, such as Lovina Beach in Kalibukbuk, Kayu Buntil in Kampung Anyar, which I talked about the other day in my video, Garogak, Bungkulan, Giri Emas and Sawan, and Kubuadaan as well in Evidence Village. And so the coastline here gets battered by the high winds that we have up here in the north, along with the intense rain and waves from the ocean. According to Pakadipsa, abrasion in Buleleng occurs almost every year. That's what I've said, especially at the peak of the rainy season around January to March. The erosion of the land is due to seawater, is also considered very important to get fast handling so that it does not threaten the condition of settlements for coastal residents who make a living as fishermen, like in all these kampungs here along the coast. And this goes all the way from here, all the way to the east and all the way to the west, past the Lovina area. According to this article, abrasion also threatens a number of hotels. Some hotels do not comply with coastal boundaries, so the impact is that they will be hit too, according to Bakadipsa. The Public Works Office in Buleleng has provided guidance to hotels that violate coastal boundaries through their spatial control. His team has carried out direct supervision as well as from the Bali Approval Permit group. And so up here in the north, we've got a lot of hotels built right at the high tide, basically, level, and they get hit during these intense storms. That is it. If you found this helpful, useful, informative, not irritating, humorous, please give it a thumbs up. And if you haven't subscribed, please consider subscribing. And thanks for viewing. Be kind to someone today. Stay safe. And I will see you on Wednesday.